Snakebite is a big problem in Africa, and it is estimated that between 20 and 30,000 people a year get killed by snakes. In South Africa, we have up to about 4,000 bites a year, and of those, about a quarter of them or even less end up in hospital, and very few people need antivenom. But snakebite is scary. Snakebite, people panic. We see paramedics panic, and it's vitally important that you do the right things in the event of someone being bitten. So this is our complete snakebite kit. Right, so in the first aid kit, we have our first aid booklet. Very, very important. It's a 24-page booklet, and it gives you all the do's and don'ts of first aid for snakebite. It tells you exactly what you shouldn't do, and it tells you exactly what you should do in the event of any snakebite. And a marker pen will help in cytotoxic bites, where you can make a circle around the area that's affected or swollen or discolored, and you could do that again in half an hour, and it's going to give the doctors a very good indication of how rapidly symptoms are progressing. For cytotoxic bites, snakes like puffaders and Mozambique spitting cobras, there's very little that you can do from a first aid point of view. And the most important thing in any snake bite is to get the person to the nearest hospital. In neurotoxic bites, specifically black mamba and Cape cobra, one is concerned that the patient might deteriorate very quickly. We talk about rapid progressive weakness. And in those cases, you firstly want to apply a smart bandage. And there you can see one of our smart bandages. And these are stretch bandages. And the whole idea is that you apply the bandage from the site of the bite up towards the heart, and you stretch it until it makes these squares. And the importance of that is that if you apply the correct pressure, you can slow down the rate at which venom is absorbed. So pressure bandage immediately. You can also apply a splint to minimize movement, because the more movement you have, the more you stimulate the muscles, the quicker the venom spreads. Next up is that your patient might stop breathing. And once a patient stops breathing and they don't get oxygenated blood to the vital organs in the brain, that patient is brain dead, and there's no turning back then. So if your patient stops breathing, we recommend the use of a pocket mask for mouth-to-mouth resuscitation. I really like these pocket masks because you can get a very good seal over the mouth and nose. There's a barrier device, so you can't get bodily fluids into the mouth of the person that's giving the breaths. And with adults, we give a breath every 6 seconds, a nice slow breath. Over a second, you want to see the chest rise, and then you want recoil. With children, we now give a breath every 3 seconds, and with babies, every 2 seconds. And the nice thing about the pocket mask is you can actually turn it upside down and use it on children as well. The pocket masks, very, very important. And in severe cases, if you're very far from medical assistance, we recommend the use of a bag valve mask reserve, a BVM. BVMs are absolutely brilliant in the hands of the right person. So with a BVM, you obviously need training in how to use it. So a BVM in the right hands is really a life-saving tool. One usually requires 2 people, one to get a good seal over the mouth and nose, and the second person just presses on the bag and makes sure that there's a chest rise. But very important, before you want to even try and use a BVM, you need the correct training in how to use it, and we recommend a basic life support course. They really are very, very good courses. You obviously keep on giving your patient artificial breaths until such time as the person gets to a hospital. For spitting snakes, we have a container to rinse the eyes. So venom in the eyes, you rinse it out either with water or with saline, and you get that person to a medical doctor as soon as possible.